In a busy ophthalmology practice, keeping track of where patients are, what step they are in, and who needs attention next can quickly become challenging. GoodX RFID workflow helps practices stay connected by automatically updating patient statuses throughout the day, improving visibility, communication, and patient flow. The journey begins when a patient books an appointment, either online through MyGC or directly with the practice. Once confirmed, the patient is added to the practice workflow, and their visit is prepared in advance, and on GoodX Web's diary side, the patient can be seen under the status of booked. When the patient arrives at the practice staff identify the patient and link them to an RFID tag attached to their visit clipboard. At reception, the assistant taps the RFID tag against the GoodX RFID receiver, automatically updating the patient's status in GoodX Web to arrived. In so doing, notifying the practice staff that the patient has arrived. No manual follow-up, no uncertainty, just real-time visibility. As the patient moves through to the examination room, the assistant carries the patient clipboard and taps the RFID tag at the next relevant RFID receiver. The patient's status automatically updates again, allowing staff to immediately see where the patient is in the workflow. This helps reduce bottlenecks and keeps the practice moving efficiently. When the patient is ready for consultation, the assistant brings the patient clipboard into the consultation room and taps the RFID tag against the relevant RFID receiver. The workflow updates automatically, notifying the doctor through push notifications that the patient is ready for consultation. RFID room indicators also provide a clear visual status of room availability. Staff stay informed, doctors know where to be, and patients move through the practice with less waiting and confusion. If treatment or a procedure is required, the assistant guides the patient to the next step of care and triggers the next RFID update using the patient clipboard. A status update automatically notifies the doctor through push notifications that the patient is ready for treatment, ensuring the care team stays informed while keeping workflow interruptions to a minimum. Once treatment is complete, the patient returns to reception for final administration and billing. The assistant performs one final RFID update, marking the patient journey as complete. From arrival to consultation, treatment to completion, GoodX RFID workflow helps ophthalmology practices improve communication, reduce delays, and create a more connected patient experience. GoodX RFID workflow, smarter patient flow for modern ophthalmology practices.